Hello pet parents and welcome to another episode of Natural Pets TV. I'm joined by Heidi Nevela, Dr. Liz Bales, and Dr. Patrick Mahaney. All of us as pet parents want to do the best that we can, and there are things that we should do and things that we probably should not do. Dr. Liz, how do you advise folks to help their cats at home?
It's a fantastic question. And the number one thing that I would say is you want to have a relationship with the caregivers to your pet that you feel comfortable calling them. It's a big blanket to say, what can I do, what can I do? And it really needs to be handled on a case-by-case basis. So if you think, my cat has diarrhea, can I give it my medicine? Before you do anything like that, you want to be able to call your veterinarian and say, is this going to be safe or not safe? And you want to have the sort of relationship with your veterinarian that they can take the time, or their staff can take the time to give you an answer, to know what's safe and what's not safe. So for me, if it's providing care with medicine in that sort of way, I want a phone call. But what I would really like to urge pet parents to do is to make sure that they, number one, have annual visits. We want to know what's going on with your cat's heart and lungs and teeth and body condition in a way that you can't necessarily just observe at home. So an annual visit at least once a year, and in an older cat, maybe more, maybe twice a year is best, is a good place to start. In between those visits, being very observant of your cat. You want to notice behavior changes. You know, they're going to the litter box way more than they used to, or I'm scooping only, one piece of feces a day. It used to be 4. I want to know those changes before they end up in a big problem. What other things do you think about?
I think it's a couple of really good points. Like being as informed as possible as to what's going on with your cat's day-to-day health is going to help the veterinarian to be able to resolve the problems and figure out the problems a lot better than just blindly going in and testing for everything. So I always suggest cat owners are super familiar with their cat's bodies by observing and feeling and smelling as well. You should always put your hands on your cat's body, as much as they're willing to reasonably tolerate, of course, but actually generally cats that are touched more are easier to handle, and also for we veterinarians too. Those cats that are familiar with having their feet touched, having their nails exposed and hopefully trimmed at home as well.
And don't forget that dew claw.
And the dew claw too. We don't want any overgrown nails. Those are very painful and sometimes challenging to resolve. Feeling over the body for places where there might be warmth or cold, places where there could be pain, lumps and bumps, which I consider mass-like lesions, which could be a tumor or some other kind of skin problem. Besides just feeling your pet, smelling your pet, sometimes the aroma from the mouth is very strong. That can indicate periodontal disease, or even as endocrine diseases like kidney disease advance, there's a very strong breath that occurs. Sometimes cats, when they get older or they're overweight, can't groom themselves as well, so the area around their tail base smells. That could be because feces is stuck back there, or sometimes the anal sac doesn't empty as well as it should. It could abscess, it might need to be expressed and medicated. So feeling, smelling, and observing your cat very closely and immediately addressing all those problems with your vet.
And one of the best tips I can give so that you start the vet visit out properly is some carrier training.
Yes.
You know, if you want to know, one of the best things you can do for your cat at home is to make the carrier not a source of terror. And it's easy enough done if you just leave that carrier out all the time. Put a really nice cozy bed in there and even feed treats in there, and make that a familiar, safe place to spend time, so that when the day comes to take your cat to the vet, they don't feel shocked and horrified before they even get there, but they feel, you know what, this is a safe place for me. This is different, I'm going on a journey, but I'm starting out as calm as I can in this process.
One thing I like to suggest is to keep a journal as from whatever point your cat entered your home, so you can document any changes, better articulate it. When we go to see our vets, we don't always remember everything, so that's a really good benefit inside and outside the home. I really am strong on toxin avoidance, if at all possible. Can you limit scented candles, dryer sheets, scented laundry, soap, air fresheners, right? Definitely, there are neurotoxins in most of those things, and people don't maybe know it. If you can do filtered water, there are fluorides not necessarily needed by cats, so there's low-level endocrine disruptors in some of the water supply, and definitely heavy metals. And then we talked a little bit about making sure your cat has specific spaces for drinking and eating, and they're independent of each other. I like to check the gum line and constantly on cats because they're at risk of disease in the mouth. And then just a really nice basic at-home care, in no way to replace veterinary visits, which are critical, but just to have it's an herb in either liquid or powder. You can get it pretty much anywhere. It's called sangre de grado, and you can use it for, yes, exactly. You can use it for so many things. It's palatable for cats, believe it or not, even without flavoring. It's highly accepted. And then it can be used for acne, for gum line lesions, abscess, little cuts and scrapes. It helps with if there's alopecia. It's a collagen production, so a collagen stimulator. So it's just a real, and there's no contraindications, interactions, or cautions associated with it. So you can use it with anything else in your cat's life.
Is there a dose that you're comfortable?
Well, usually it's a cat capsize, so it's usually around 150 milligrams. If you're taking it internally, if it's a liquid, you're just dabbing on and spotting it onto wherever the area is in the body. But another thing is, as cats age, if I like to make a suggestion of a maca or a suma. Also, maca is a pretty well-known herb, and it's available pretty readily. And it's great for endocrine support, digestive support. It has a support for the brain as cats age, joint protective. It's got a digestive element to it, as well as elimination. So it's kind of a nice thing you can add nutritionally, and it's got all essential and non-essential amino acids in it. It's got protein base that's agreeable, low sugar, low carb, almost none of that actually. Anyway, just a nice nutritive, and it's a superfood. It does a lot through all life stage cats.
Great thing to think about is grooming. To make sure that it's a great way to just go over your cat's body every day. And mats in longer haired cats can actually cause all sorts of problems as they twist. That becomes painful on the skin, and they can get an infection underneath that mat. And if your cat spends time outside, you can even get maggots under there. So making sure that you regularly groom your cat and make sure that none of those things are occurring is really important. In addition, if you find a mat and you are unable to comb it out, you want to think about getting some little beard trimmers, little tiny electric razor that you can trim that mat out with. I strongly urge you never to use scissors at or near your cat's skin. When we call it tenting, I'll just give you a little tenting here. When you pull that cat's skin up, when you think you're pulling just the mat, it's so hard to tell where the mat stops and the hair begins. And the teeniest little snip when it's pulled up, when you let it go down, that little snip all of a sudden is an enormous cut. And that can be really dangerous and pretty avoidable with gentle use of a beard trimmer.
On more times than I'd like to say, I've had to repair the laceration that's created by an owner cutting off a hair mat from their cat. And it's so frustrating for the owner too, because like they feel terrible that they've done it. Right. They're trying to help. They accidentally created this problem, and then you have to anesthetize the cat or deeply sedate it to fix it. Oftentimes that actually gives you the opportunity to cut other hair mats off the cat if they're there. So that's for regular grooming. If you're not comfortable doing home grooming yourself, you could get a groomer to come to your home to do it. That also helps to reduce the fear of having to go into a grooming facility. Yeah. Most grooming facilities are really geared for dog grooming, not so much for cats. So it does take that special groomer that has the experience and the gentle approach to be able to work with the cat. But so crucial to keep your cat's skin and coat refreshed. A lot of times as they're getting older, as Heidi mentioned, they're not grooming themselves as well, so you can get skin flaking that accumulates, especially over the back. That can also indicate that there's a problem inside along their spine. They get arthritic changes along their spinal facets, which are little tiny joints that keep the spine in place, so they just can't twist and turn to lick themselves back there like they once did. So you as the owner really needs to intervene. And I love giving my feline patients supplements with fish oil-based omega fatty acids to promote a nice phospholipid membrane barrier on the skin, to have a naturally anti-inflammatory effect for the skin, for the joints, for the nervous system. There's a lot of things that you can do for your cat, and it's definitely good to get your veterinarian's input on it too, because we want to make sure we're giving a product such as a fatty acid for a cat that is appropriate. It isn't scented with lemon or mint, doesn't have any kind of artificial color or something like that, and it's something that's very palatable and well tolerated.
And I don't want to forget the ears. A cat's ears should look on the inside like yours and mine and be nice and clean. If you're noticing a lot of debris in there, it may not just be debris. It may in fact be an ear infection or ear mites or something that requires intervention. So you want to take a good look inside your cat's ears as well.
One more thing, do not give dog, flea, and tick medications to your cat, or aspirin, Tylenol, and there's other cat safe options and that are natural. I'm sure you have a lot to say on that.
Yes, yeah, on more times I'd like to say I've had to, on an emergency basis, treat patients where the owner has gone to the Rite Aid or whatever drugstore and has picked up a product that's a dog flea and tick topical product that has an agent in it that the cat body doesn't accept as well. And the cat starts tremoring and twitching, and usually they have to be hospitalized and put on muscle relaxers and supportive care like IV fluids. And I have seen it kill cats before too. So it's really, really crucial that you consult with your veterinarian about what is the most appropriate topical or oral flea and tick product for my cat.
In addition, those things are based on weight.
Yes.
So making sure that you have an accurate weight of your cat and you're giving something to them that's appropriate. You may think you're saving $1 or $2 by getting this stuff at the grocery store, but you end up actually having hundreds or thousands of dollars in veterinary bills trying to save that few bucks. So it really is a good idea to make sure that you have safe and accurately dosed flea and tick prevention.
And grooming products. Make sure cat-specific grooming products, as dog products are not always well tolerated either, sometimes dangerous.
Tea tree oil is commonly included in many shampoos for people and also in some pets. You have to consume a pretty concentrated amount to actually be toxic, but as cats really spend a lot of time grooming themselves, I would not recommend bathing your cat in a tea tree oil product. Consult with your veterinarian, try to get a shampoo that's maybe all natural, or if your cat has a specific skin condition, there can be shampoos that can lift off scale or flush out follicles or have an antiseptic effect. Just really depends on your cat's needs.
Well, a lot to know there. I want to thank you for joining us here on Natural Pets TV. Hey folks, thanks for joining us here on Natural Pets TV. So many great topics, so many wonderful experts, but we want to keep the conversation going in the comment section down below. Let us know what you think. Let us know what you want us to cover in future episodes. And if you want more information, you can always reach out to us at petworldinsider.com, or for more information from our guest, you can get that at, for Heidi Nevela, natureofpetswithaz.com, for Dr. Liz Bales, nobowlcat.com, and for Dr. Patrick Mahaney, patrickmahaney.com. Thanks for joining us, and we look forward to seeing you again soon.